A very good evening, ladies and gentlemen. Welcome to Pratignja. Welcome to Welcome to 15 days online certificate course on Prajananeeyam, that is Art of Infertility Management in Ayurveda. And before going through the session, let's have a look through our previous online certificate courses. And these are our valuable responses and reviews which we have got from our dear participants previously. And for more details, kindly visit us at www.pratignja.com, and you can also reach us through pratignja@gmail.com. And general guidelines for the participants are, please make sure your roll number is displayed before your name while joining the meeting. And we will be opening the meeting by 7:30 p.m. usually and starting the meeting by 8 p.m. And make sure you keep a very positive mindset while asking the questions and chatting in these groups. And thus, welcome a warm welcome.
So, a very good evening to one and all who are present here. I thank Pratignja, the team Pratignja, my good friend Dr. Shamohan, Dr. Anjana, and Dr. Rahul for having me here. Today we are going to talk about male infertility and the nidhanas leading to it. So I will try and let you know what kind of nidhanas I have been looking for, being a Romanidhan person, how I look at any type of male infertility case or any other case for that matter of fact. So, can I start sharing the screen, Dr. Anjana?
Yes, sir. Kindly try again, sir.
Yes.
Thank you, sir.
So, Ayurvedic and modern understanding of nidhanas leading to male infertility. This is a part one of the talk. We have three parts. Hi, I'm Dr. S. Bharath Narendra, own chain of clinics at Chennai. I'm also the former associate professor of Department of Roganidhan and the HOD too, from SJSACH Nazratpet. So basically, we are going to look at what is infertility, how we are going to approach it from an Ayurvedic point of view. Infertility is actually like a pandemic. It's like a silent pandemic. In India alone, more than 10 million cases per year are getting recorded. These are only the recorded cases because of social stigma and many other cases. Many people don't even know that they are suffering from infertility, and because of that, they don't approach for help. So, why am I calling this a silent pandemic? I'm calling this a silent pandemic because imagine having 10 million cases or 1 crore cases every year. Not even one of the recent pandemics can come near the number of cases that the infertility is producing every year in India alone. This is basically because of one reason called what I like to call it as, I like to coin it as EACIRC. That is endocrine altering chemical induced reproduction crisis. The endocrine glands in the body are responsible for the many things in the body. One of the most important things is the fertility. It almost controls the whole of the reproductive system because of its hormones. In my talk, today we'll be looking at the Nidanas, and later in the second part, we'll be understanding how clinically we can approach infertility. And in the third part of the talk, we'll talk about especially Utravasti and other Sthanika treatments that we get. Utravasti is one of my specialties. I have almost done 4,500 Utravastis in my career, or at least I've trained some of my students and my assistant doctors also to do it. So these, it is a very surprising thing that when you give Utravasti, it can have a backward feedback mechanism and it can alter the endocrine glands and their secretions. For example, we had a case who was having high prolactin. In males, when they have high prolactin, it is very important to go and check their pituitary gland, especially the anterior pituitary gland. An MRI with contrast or something is done. Sometimes with contrast, sometimes without contrast, because sometimes the clarity is not good, then you have to go with the contrast. So when we do this MRI brain, we can sometimes come to know that the patient is having a microadenoma in the anterior pituitary. This microadenoma in the anterior pituitary will keep on making the person produce more prolactin, and hence the person will be a clypea, or he will be infertile. He will be in polyvasculoteratozoospermia, or most of the times azoospermia. When we came to know this, and the patient was not ready to go for allopathic treatment, he did not want, he looked at the side effects that we actually suggested an endocrinologist, and the endocrinologist gave some medicines, and after giving these medicines, after prescribing these medicines, when he asked what are the side effects, there were so many side effects that he was not able to, he did not want to go through all those things. He did not think it was worth it. So I told him, not only giving medicines, I will also have to give you some nasyam and some Utravasti. So there was a discussion between me and my fellow doctors, my assistant doctors. We were thinking whether to give the Utravasti first or to give the nasyam first, because we know that the pituitary gland is involved and the prolactin is high. What happened was, when we kept asking about the Nidana, we did not find any, because we asked extensive questions about Nidana. When we started asking many questions, it came to our know that he has been using a lot of junk food and outside food, and he was not able to take his home food regularly, and we were not able to find any other big Nidana. So I said, when this has come through the Koshta, because he doesn't drink, he doesn't smoke, he does not have any other bad habits, he does not use tobacco. Even long use of tobacco can lead to sometimes some microadenomas in the brain, so on and so forth. So I said, because it is coming from the Koshta, it is always good to treat the Koshta, and slowly when we started talking about it, then I understood that Basti was in order. In all my Utravastis, especially when the patient starts his or her first Utravasti, when they start the first Utravasti, I always start with the Kashayavasti. That is, in a Yogavasti, first 2 days, I give Matravasti, I don't give Uttravasti. On the third day, when I give Kashayavasti, I start the Uttravasti. In most of my cases, I do this, especially if they are doing this for the first time. I also make sure that there is a Virechanam done so that a Sthanika Shodhana is also over. What will this do? This will make sure that the Koshta is first cleared. There is a Sthanagata Shodhana. And after the Sthanagata Shodhana, there is also the remnant doshas will always be there after doing Shodhana. Okay. Even if you sometimes, rarely, even if you get a very good Shodhana, still you might end up having a little bit of the doshas left out. So when we started the Vasti and then the Uttravasti, after I think 3 sittings of Uttravasti, 3 sittings means in one sitting we do 8 Vastis, Yoga Vastis. In that we give 5, sometimes 6, sometimes 8 Uttravastis. We'll be talking about that later, why I'm doing all these things, because Acharya has told only 3, some Acharyas have told 5, some Acharyas have told during menses you have to do, some Acharyas have told you have to do when there is no bleeding, so on and so forth. So coming back to the case, after doing this 3 sets of Uttravasti along with the Kashayavasti, we took up the prolactin levels. The patient was not willing to go for an MRI, but when we took the prolactin levels, it had come down considerably. We used Kapha, Pitta, Hara, Tikta drugs. We'll talk about the case later. And we gave Kashayavasti. Along with this, we gave Uttravasti. So this even alters the problems which are there in the brain. This is what I'm trying to say. So endocrine altering chemical induced reproduction crisis. These kind of chemicals are found day in and day out in our life, from the plastics that we use, from the wood plywoods that we use, from the varnishes, from the paints, and many things that we use on a day-to-day basis. These things are affecting us. These kind of chemicals which affect our endocrine system is leading to a reproduction crisis. If this is the truth, then why everybody is not affected? This is a great question that many people ask. It has only one simple answer. Not everybody has the Prakriti and the Vikriti. When you have the same, for example, if you have a Pitta and a Kapha Prakriti, nobody is of single Prakriti as Acharya says. So if you are a Pitta Kapha Prakriti person, generally it is very difficult for us to treat if you get a Pitta or a Kapha or a Pitta Kapha problem. This is what Acharya says. But in reality, it is also very difficult for you to get a Pitta Kapha problem rather than getting a Vata problem. This is with experience I'm talking. So these kind of endocrine altering chemicals affect only people in whose body the Shukravas Rotas is already having some kind of small problems, or his Rotolina is already there, as Acharya says. Doshas are first kindled, and then these doshas go all over the body. Wherever there is Rotolina, wherever there is weakness in the Srotas, the problem is created there. So what is the need for Ayurveda in these kind of conditions? Why not go to evidence-based medicine, or they call it as evidence-based medicine, or allopathy? Why not go to allopathy? Let us see what allopathy can offer. The success rate in allopathy is somewhere around 5 to 20% of all the walk-ins that there are who are coming to any allopathic infertility clinic. That is, if 100 people come, 5 to 20% of them, 5 to 20 of them may get a progeny. And this is based on the lady's age and the lady's health. The younger she is and the healthier her reproductive system is, more the chances for her to have a better progeny. One second, I'm not feeling well. I just need one small help. Please wait. Sorry, guys. So, the walk-ins, the situation is 5 to 20% based on the lady's age and the lady's health. The male factor infertility. There are two things that come in infertility: the female factor infertility and the male factor infertility. The male factor infertility is merely reduced to vitamin supplements. They give CoQ10 or alpha tocopherol, or they give vitamin E and vitamin C to increase the either to increase the sperm count or to reduce that sperm's DNA damage and so on and so forth. But we have medicines, we have panchkarmas, we have specific treatment protocols where we can increase the motility of the sperm, we can alter the morphology of the sperm, we can change the count of the sperm, the viscosity, the color, the order of the sperm, the smell. All these things can be changed with our medicine. With simple treatments. An ordinary Triphala Kashayam, which is regularly taken, and a Triphala Churna wash for the penis will lead to any kind of Daurgandhya from the penis. Along with this Triphala, sometimes we add medicines like Chembarati, hibiscus, sometimes vetiver, and all these things we add, depending upon each person's system. We also give some thylums or grithams which can be applied in the penis after retracting the foreskin. Not only treating clybia, a person can also be made into a clybia with, if the medicines are not used with the discretion. I have a patient who is having a mild hydrocele and varicocele, about 54, 55 years old. He was suggested the Turadivati application on the testicles for his hydrocele and his varicocele. But after having this continuously, one second, madam, the end. Sorry, guys. So, after having this Daturadivati application to his testicles continuously, and he was told to do this for some 30-40 days before he came to me. But what he did was, he used this continuously, and then he went back to the doctor after around 3 months, the other doctor. The doctor saw the results. He was having pain in his testicles, and the Turadivati was helping him to get relieved of the pain. Basically, because it was giving more rukshna to the testicles, and the Drava Bhava and the Sarabhava was being reduced temporarily, and he was getting relief. What happened was, this man absolutely lost whatsoever was his libido. He was not having any sexual feeling towards his partner. And he was trying to become a yogic person, and he was into all this meditation and all that. And hence maybe, he was okay with it a little bit. But this is also the side effect of the medicine when it is not used properly. There was another case with the same Daturadivati, again in his 50s. But this guy I don't know if it was the same doctor or somebody, but the doctor has again prescribed the Atherosclerosis external application. And what happened was, this time, he developed kind of burning sensation and itching in and around the testicle area. And what happened was, after developing this itching, he also started losing his libido slowly. And at one point of time, it's very important to maintain the hygiene of the reproductive organs. When he came to me, most of us doctors, because of stigma, social stigma, or thinking what the patient will think, how can I ask this to the patient and all, let it be a male patient or a female patient. Ethically, if you're doing things, I don't think there is anything wrong. If you are going to examine a female patient, have a female doctor with you. That's all. That's all. Okay. There is nothing more to it. Coming to this male patient, most of the times the doctors did not examine him at all. They saw the report. They asked him what his problem was. He said, I'm having pain in the testicles. And they started giving the Turalivati. The history behind this, one of the cases was, he had a bad fall while he was traveling. He just sat on his back. And after that, he developed the back pain and this testicular pain. This history was not taken properly. And hence, one of the main medicines I gave was Gandha Tailam. Gandha Tailam has nothing to do with fertility. But when I started giving Gandha Tailam along with Chandra Prabhavati, the patients, all symptoms were solved. Even before crossing the first slide, why am I talking so much about this case or these cases is that if I had not taken the Nidana properly, if I had not taken into account what happened to him and why it happened, I would have never solved this case. And I would have always been maybe prescribing the Pradivati again, or I would have done something else like that. But then, the reason behind choosing Sandra Prabhavati and the reason behind choosing Gandha Tailam was this, that he had a fall. So this is why we need Ayurveda, my dear friends. Ayurveda does not look at the reproductive system as the reproductive system alone. We don't only look at the reproductive system. We look at the Panchavedavata. We look at the Vibhavasthana. We look at the Sancharasthana. We look at the Vyaktasthana. So according to the Nidana, the medicine will be decided. And according to the Sthana or the Sthana Samshraya, the Aushadikala will be decided. We'll be discussing this in the next forthcoming slides. This is how I approach my cases. Each case will be different. In each case you will be challenged. And even after 10 years and 15 years of practice, yes, you will have doubts on a daily basis. Keep going back to your roots, keep going back to your Nidana, Pururpa, Rupopashaya and Samprakti. Only then your treatment will prove good. So, this presentation that we are looking at here, after this, when it's said that in modern evidence-based medicine, they take only vitamin supplements for male factor infertility. I've taken a lot of studies. I've gone through a lot of studies. Somewhere around 16 international studies have been taken. And out of these 16 international studies, only 4 have come out with significant results. And when they say significant results, it means 10% pregnancies, my dear friends. Imagine you have 100 fertility couples coming in, and you can give a 10% success rate. you call it significant? Maybe you can market yourself well. If you know how to market yourself well, maybe with the 10% success, you can still be a great infertility practitioner. God knows whether you got the success or was it by chance. I mean, there is a very good chance that out of this 10%, at least 3 or 4 people were because of by chance they got conceived, right? There is a very good chance for that. So this is why we need Ayurveda. With Ayurveda, we can deal successfully with 50% of the cases. That is, they will result in pregnancy. Every second person who comes to you, who's a walk-in, who's not selected, who's not filtered with processes, that is for doing IUI or IVF or ICSI or TESA, people are filtered and they are selected, right? The selection process is eliminated. That is, if you select them and then say, if 100 people are coming in, and then you select 10 out of them or 20 out of them, and then say, these are arhas, they are good for IVF or IUI. And then out of those 10 or 20 people whom you have selected, if you are able to give 5 to 20% of results, imagine the amount of result you are getting. But with Ayurveda, if 100 people walk into your clinic with infertility, 50 of them can go back with positive result, pregnancy. Another 25% will be varied levels of successes, because sometimes the patient will drop out because they have to get transferred. Sometimes people do not want to take Ayurvedic medicines. The taste is not good. They have all kinds of reasons. Sometimes the smell is not good. Okay, so it depends upon what priorities the patient has. Sometimes there is always a 20 to 25% dropout. Then there is another 25% which you cannot treat. That is because of Bija dosha or congenital problems. There can be a Klinefelter syndrome, Kallman syndrome, so on and so forth. So with Ayurveda, when you have treated them for the first issue, when you have treated them for the first child, they come back for treatment for the second child only after getting pregnant. That is, you don't treat them for infertility for the second time. This is not the same case in allopathy. When you do IUI or IVF for the first time, already the patient is completely fed up with all the injections and all the hormones and whatnot that you have given her. And the whole problem would have been with the husband. The lady would have been completely all right, but the treatment will be given to the lady. Doesn't this sound bizarre? Already when she is ovulating properly, already when she is having a regular menses, medicines will be given to her. When she is menstruating properly, medicines will be given to her to bring the menses correctly. Cycle tablets will be given. Already when she is getting ovulated properly, it will not be an anovulatory cycle. Still injections will be given to make her ovulate. And still medicines and injections will be given to make the ovum rupture. The rupture would have happened normally if it would have been left out, but still medicine will be given, and for no mistake of hers. In most of the cases, the male will be the problematic person. The male will he would have had a lot of alcohol, a lot of smoking, and all other habits, and because of that, or maybe riding their bike for too long daily, maybe because of his job. Again, not his mistake in this case, but then yeah, the nidana would be in his part, and the problem would be in his past. He will be the clypea, but the treatment will go for the lady. This doesn't happen with Ayurveda. We can intervene where there is a problem. And the second issue happens without medical intervention, and they come only for antenatal care and postnatal care. When the patient comes to you, there is nothing wrong in going for an Ayurvedic and a modern examination. Please mind you. Always examine the person properly. Do not become shy for this. Always have 1 or 2 doctors along with you. There can always be a human error, even after 10 years and 15 years of practice, which they can point out at times. So, infertility and these assisted births are not a part of Ayurveda from yesterday or day before yesterday. This has been a part of Ayurveda from the time of Itihasas. For all the matter of fact, from the Itihasas, we can know that when Brahma, he started creating, Lord Brahma, he kept on creating from his own image, and then he became tired and he sat, and his cloning machine just cloned somebody, and this time it was a perfect this time. So cloning has been there. You can see Sita, Draupadi, they were all not normally born, not through normal conceiving method of sexual this thing, which is not there. Kauravas, the Garbha was smashed by Gandhari herself, and this was taken by Vyasa Maharishi, and it was kept in pots which had grita, they say. See, when they say grita, they want you to understand they are not talking to Ayurvedic doctors, or they are not talking to physicians. They are talking to laymen. When they are talking to laymen, they want you to understand what it is. When they say, if I say it is a synthetic amniotic fluid, nothing will be understood by the person. When a layman does not know what is synthetic amniotic fluid. Okay. So, for you to understand, it has the viscosity of grita, it looks like grita. Then the shape, the artificial amniotic chamber, that's what we call it. But he called it as a pot, so that everybody will understand. It look like a pot, so it's a pot. And the parts of this garbha was kept inside, and the totipotent cells from the garbha, that is the total potency. These cells have total potency, and they can grow into any form, any tissue for that matter of fact. These totipotent cells, which we know today, were taken most probably by Vyasa Maharishi, and they were grown into full-grown human beings. Even Pandavas, in Pandavas' case, there was sperm donation. Pandu was not able to give, but Kunti was able to conceive, so sperm donation was taken from the gods. Rama and his brothers, here the father was good, was healthy, but his wives were not healthy maybe, and hence the payasam was taken and given to them. We all know that his 2 wives. When I say payasam, again, it's not payasam, right? In Ayurveda, we have Manda, Vilepi, Kritayusha, Payasa. We have many types of preparation. The way of preparing the medicine. After doing all that yajna, in that fire, they created this medicine. That's all. Okay. So these kind of hormonal medicines to ladies, these kind of cloning, these kind of totipotent cells which were taken, and test tube babies, sperm donation, what not was available in Ayurveda. Yes, I understand today it's not available with us, but still, we are still able to give 50% result. So subfertility in today's world is a real current burning problem, like how I told you. And the available treatments in modern evidence-based medicines are most of the time short-lived. For example, if a person comes with erectile dysfunction in male infertility, we all know the common name of this medicine is Viagra, called sildenafil, right? Short-lived. For that time period, he will be able to perform sexually. After that, there is no permanent solution, right? You need to give a permanent solution. Sometimes it is a topical gel, testosterone gels are given, sometimes surgically penile implants are given, and these are all in erectile dysfunctions. When there is an IUI, or when the person wants to conceive and he is not able to, then an IUI or IVF or a sperm donation or a TESA is done. I think you all know what is testicular aspiration, right? That is when the man is having azoospermia. It is assumed thus in his seminiferous tubules, still sperms are there. This testicle is drilled, and after that, a part of the seminiferous tubule is surgically taken out, And from the seminiferous tubules, sperms are taken out, and these sperms are used for fertilizing the eggs. In my experience, because people go to all allopathic treatments and then they come to Ayurveda. Experience, not even one case of that has been successful. But there can be a bias because, as I told you, go there. After it becomes unsuccessful, they come to us. So maybe because of that reason, whichever case I've seen could be a because it was not a success with Tesa. But then whatever I've seen, it has never been successful. And also a lot of severe side effects are there in these medicines, and there are a lot of adverse drug reactions, ADRs. We say Beshajam Vividam Chatat Swastasya Urjaskaram Kinchit Atherosclerosis Roganat. Some are when the person is already a swastha, then to give more ojas, to give more urja, we give medicine to give more energy to the person. Kinchit Atherosclerosis Roganat. That is when the patient does not have any roga. When the patient has a roga, then to do shamana of the roga, some medicines are given. But this urjaskara medicines, which increase the swasthya of the person, swastasya urjaskaram yattu tad vrishyam tad rasayana. So whenever you want to treat a person with vrishya or rasayana, before that you should have made him a swastha, which means you should have definitely given him some of the other kind of shodhana. That is what we are going to see here. What kind of shodhanas can be given, what kind of nidanas we are going to look at. Both these rasayana and vajikarana medicines can be interchanged, as all the fertility problems involve the guhya and the reproductive organs, directly or indirectly. I use a lot of vastis and utravastis because it is in the apanasthana. So, coming to the main part of this talk. When I see the nidana of the person, what do I see? Do I see what he has done? Do I see what he has eaten? Do I see the doshas which are increased? Do I see the gunas? There are various levels of understanding. There is a guna-based chikitsa, there is dosha-based chikitsa, and so on and so forth. But if you can take a list of all the nidanas the patient has done, and if you are able to interpret it into Vata Pitta Kapha, which is quite easy, if you can sit for some time, maybe 1 or 2 hours. Initially, you will take that much of time with each patient. Then later stages, you'll be very fast because you know what you're doing. The nidana would have increased some specific gunas of the Vimshati gunas. We all know that is the chikitsa for these gunas will be the opposite gunas. Right? Whatever is increased, the opposite guna you give, this will decrease. Or whatever is decreased, you give the same guna, that time this will increase. Okay. This will be the total idea. Very simple to say, but not very simple to do. That's it. By this, you also know, by looking at the nidana, you also know the udbhavasthana, like how we talked about the high prolactin patient, the prolactinemia patient. You know the udbhavasthana. For example, in Sandhigata Vata, very easy thing, every one of you would have seen Sandhigata Vata patients, so I'm using this example, although it has nothing to do with the reproductive system. Sandhigata Vata, you will see Ruksha, Laghu, and Khara Bhava are increasing. There will be more. The meniscus would have become degenerated, the cartilaginous loss can be there, bone tissue loss can be there, there can be osteoporosis, right? Osteophytes can form, there can be tibial spiking. In the condyles, there can be osteophytes which are formed. The joint space could have been reduced, so on and so forth. In all these conditions, there is a Luksha, Laghu, and Khara Bhava which are increasing. So out of the Vimshati gunas, when you know the nidana, directly you see the opposite gunas which are told in Vimshati gunas. I will use a Snigdha for Ruksha, Guru for Laghu, and Slakshna for Khara. Simple. And I will also be treating in Sandhigata Vata, I will be treating Vyanavayu, Apanavayu, and Sleshaka Kapha. When I know the nidana, and when I know what guna is increased, and when I'm giving the opposite guna for the increased guna, why do I need to look at the Vyanavayu, Apanavayu, and Sleshaka Kapha? My dear friends, looking at the Panchavida Vata Pitta Kapha is the sole reason of my success. before the second class starts on 25th, I believe, please be sure to, or please ensure that by heart you know Panchavida Vata, Panchavida Pitta and Panchavida Kapha slokas. Please. Because in some places I will take this as a reference. I'll keep telling the slokas when the talk goes on and forth. That time I don't want you to miss out on it. So, Vyano Hridistitaha Kritsna Jehachari Mahajavaha Gati Apakshepana Ukshepana. Can we continue?
Sir, yes, please.
Yeah, so I will be taking into consideration the Vyanavayu because of this thing, and the Apanavayu because it is in the Apanasthana. Apano Apanakaha Shmudi Vasti Mental Gocharaha. And the Shleshaka Kapha obviously because the Shleshaka Kapha is in the Sandhi. So when I take these three into consideration, I will be giving medicines which are Vata Kapha Shamana, that is, and at the same time it is Vata Shamana and the Kapha Vruddhikara slightly. That's why the Snigdha Guru and Slakshana. So all this will fall into place. So the Nidanas will decide the doshas, and that is the medicine will be for the Nidana or the Guna.
Sir, can you kindly maximize the screen, sir?
It is maximized here. Is it not maximized there?
No, yes, now it is, sir.
Okay. So the Nidana will decide the doshas, and the doshas, according to the dosha, the medicine will be decided. And then according to the Purva Rupa and Rupa, which shows the dosha gati, that is from the Udbhavasthana till the Vyaktasthana, there will be some Purva Rupas and Rupas which will be seen. That shows the dosha gati. And also it shows the Sancharisthana and Vyaktasthana in many cases. And based on this, the Sthana Samshraya. At last, the Sthana Samshraya will happen in the Apanavayu Sthana. We all know this because obviously we are treating the genital urogenital system. And so when this Sthana Samshraya is known, that is, we know the subsect of the dosha, that is the Apanasthana. So Aushadha Kala will be for the Sthana, but not for the dosha which is aggravated. Why? Because we know, already we have seen the Nidana will decide the dosha, and whatever guna of this dosha is increased, the opposite guna medicine will be given, or whatever is decreased, the same guna medicine will be given. This much we have understood. So the dose, the medicine will be decided according to the dosha. This is clear. But the Aushadha Kala is decided only according to the sthana of the problem. For example, if you have a Kaphaja headache, in Kaphasthana you have a Kaphaja headache, then the Aushadha Kala will actually be Pranavayu Aushadha Kala. Most of the Aushadha Kalas that you have seen, that you can see in Ashtanga Hridaya or Ashtanga Sangraha, it will be only mentioned for Vata. But for Pitta and Kapha, very less will be mentioned. During the food, you can take some medicine for decreasing the Pitta, or immediately after food for decreasing the Kapha, you can take medicine. Like this, 1 or 2 places only they would have mentioned. In all the other places, only Vata will be mentioned. Whether the problem is in the head, whether the problem is in the toe, whether the problem is in the genital organ, wherever the problem might be, whatever the dosha might be, only the Aushadha Kala will always be mentioned according to the Vata. This is because of the simple reason that Pittam Pangu, Kafam Pangu, Pangavascha Mala Dhatavaha, Vaina Yatra Niyante, Tatra Gachanti Mekam. Whatever medicine you are going to give, it can be because of by Panchakarma or it can be by oral route. It has to go through the Koshta most of the times, and it has to go into the Rakta, and then it has to go to the other places. We all know this. For example, any oral medicine you are giving, it has to get mixed with the Rasadhatu and then it has to go. So when all the Pitta, Kapha and all the Dhatus, including the Rasadhatu, when it is Pangu, how can the medicine go through the Rasadhatu? Only Vayu can take. And hence, the Aushadha Kala will. So we know, we have to now know how the Ayurveda Shukra Pariksha I do according to the seminogram. That is, when a patient comes to you, the male patient's a semen analysis is taken, and the semen analysis can be used, and you can do a Shukra Pariksha according to that. So when a person comes to you with his semen analysis, you are going to look at the appearance first. There are many things like appearance, volume, pH, liquefaction time, viscosity, sperm count, the morphology, motility, cell debris, any agglutination is there or not, so on and so forth. But we all know Spatikabam Dravan Snigdam Maduram Madhugandicha Shukram Ichanti Kechittu Thailakshaudra Nivamtata. The same thing can be seen here. When the patient's semen analysis, the appearances is gray or grayish white, then that is Spatikabam. We see a lot of yellow colored sperm. And I have not seen, but I have read about a black color sperm or a dark blue colored sperm in spinal injuries. That is again in the Apanasthana, when there is an injury, that can be dark colored sperm. It is idiopathic in modern evidence-based medicine. But we see a lot of yellow colored this thing, Shukram. So the gray color is a Spatikabam. We are aiming to bring the gray color in the person. So when you know the Nidana, when you know the yellow color is there, when you know the Rupa, then you need to know the Nidana. For knowing the Nidana, you need to understand what kind of Pittaja, Ahara Vihara they have done, and then start asking questions from Pittaja Ahara Vihara, what they are doing. The patient can be having more sulfur by taking more garlic, by taking more, in some cases, a lot of garam masala, there will be some patients who are taking even, especially during this COVID time, people are very, very, very much fond of taking haldi, turmeric. Okay, too much of turmeric is also not good. So these kind of, and other things where there is a lot of sulfur content. And a lot of people who take a lot of alcohol, their sperms can be yellow in color or yellowish in color. A simple virachanam, when you know the Nidana, you will give some Pittahara drugs, and at the same time, which are Shukra Vardhaka. And before giving this, you will give one virachanam. The virachana will be given with the Tiktarasa Gritams, because it is a Pittaja problem. And after doing this Snehapana with Tiktaka Gana Dravyas or Mahatiktaka Gritam or Trifala Gritam and so on and so forth, after this you can give a virachanam. Immediately the yellow color changes into Spatikaba. So next one is volume. If the patient's volume is not good, then you have to understand that there is a Dhatu Kshaya. Then you have to understand that in the Shukra Dhatu, there is a Kshaya. For example, recently I saw a patient whose count was 58 million per ml. When I read the first line, it said that the count is 58 million per ml. I said, good, nice, very good count. But when I went below, the volume was only 0.5 ml. Okay, this I'm talking about in my early stages of my career. I first of all did not know that even for half a million, I mean for half a ml, they can take the study and then they will just calculate what will be the count for 1 ml. That might not exactly be correct. It is only a calculation. So when the volume is lesser than 1 ml, 0.5 ml, 0.6, 0.7 ml, and all that, no volume, no ejaculation, unejaculation can be there. In all these conditions, we have to take it as Vata Pitta condition, or sometimes Vata condition. If the Ushna is more also, then you can give, it can lead to the reduction of volume. For example, the case where we talked about the Daturati application was there. In that case, the Vata and Pitta was increased and the patient became a no libido person. And for him, you know what the specialist, allopathic specialist, you know what they asked him to do? They said, you are not sexually active, and because you are not sexually active, you are getting all these pains in the testicle and so on and so forth. And hence, the treatment that we give you, they have written this in his prescription, mind you. The treatment that we give you is you have to go and masturbate weekly 2 times, and you will not have any pain. Scientifically speaking, yes, the Baddha Marga, because we have a Shukrava Srotas which is working and which has movement has to be there properly. And if you're not using that Shukrava Srotas properly, then yes, if the movement is not proper, then there can be an obstruction. But that is not the final solution. You cannot ask someone, and especially he does not have any libido after all the Datturaadhivati and all that, and asking him to masturbate, he's just not able to do that. Okay, whenever he does that with a lot of problem, because he does not have the libido, he's getting relieved only temporarily. So the final solution is for the Nidana, you have to find out the spinal. We found out that he was having a spinal injury and we are treating that now. So if the volume is less, then we can give Vata Pitta Hara medicines, which are Kapha Kara medicines. Then comes the pH, the alkalinity or the acidity of the Shukra. Most of the time Shukra is alkaline. If by chance you are seeing an acidic sperm, if by chance you are seeing an acidic semen analysis in the semen, then it is a very, very difficult thing to cure. Again, Pittaja treatments will be given and Pittaja medicines will be given. Next comes the liquefaction time. Again, it has to be within 30 minutes. If it is very lesser than 30 minutes, if it gets liquefied in 5 minutes, 10 minutes and all that, you have to increase the Vishada. We have to increase more clarity, and the Vishada Guna, you also have to increase the Snigdha Guna in the Pichila Guna also in the Shukra. And at the same time, if it is very less, then if the viscosity is very high, then you have to increase more Sara Guna and Drava Guna. For each of these gunas, we are going to see what medicines I gave. Each of these things I'm talking from one case. Okay, as we told about the yellow color sperm, and then the volume being less. In the volume, when it was less, we gave him in Siddha. There is one medicine called Dhatu Pushti Legium. We gave him the Dhatu Pushti Legium along with the aloe vera gel that we use. That makes sure that the pitta and this thing is reduced and kapha is increased and the volume came up. Like this medicines we are going to talk about later. We are only looking at the Nidana as of now. Okay. So when the liquefaction time is more, then the treatment you give has to be Sara and the Drava Guna. Like this, we have seen many cases. If you increase the liquids in the body, if you for example, in my last classes, I've told that I think we discussed about a case in last Pratignja class and all that. I think we discussed about a case where I gave Samsarjana Krama as the treatment. And the patient's liquefaction time was all right. He was having high liquefaction time. So these things can be done, right? You have to increase the Saraguna and Dravaguna, that's all. If the viscosity of the sperm is very high, again, like the liquefaction time, the viscosity, if it is low, then you will increase the kapha in it, the dridata in it, the snigdha bhava in it. While if the viscosity is very less, then you will treat the vata and pitta, and you will be you have to see whether it is becoming happening because of the vata or because of the pitta or because of the kavakshaya, and you have to treat that. That's all. Then the sperm count, very, very, very important. When the patient, modern evidence-based medicine says even if there is 20 million per ml, then that is fine. That is not the case, my dear friends. They are trying to do IUI or IVF in modern evidence-based medicine in allopathy. For IUI or IVF, if the person has 20 million or around 20 million, they can just take it, wash it, and they can use the sperm. But not that way in Ayurveda. Ayurveda, we ask for anywhere between 50 to 60 million count. And when the count is not enough, you have to give regenerating medicines. This is where Vrishya Dravyas and Rasayana Dravyas are very, very, very important. When I give Rasayana Dravyas, I use in some conditions according to the dosha. This is why we need the Nidana. According to the dosha, for example, if the liquefaction time is very high, I cannot use some rasayana which has more kapha in it. Okay. Even a pippali rasayana is very useful when the liquefaction time is high. While a Narasimha rasayana is very much useful when the liquefaction time is low and the count is also at a proper. You'll be giving the rasayana medicine to increase the count, but actually the indication might not be there in the Palasruti. But I'm telling you, you have to look at the other things. Okay, the liquefaction time is also low. The alkalinity is also almost like acidic, it's very less, and then the volume is also very less. The appearance is also yellow in color. In these kind of conditions where you know that the pitta and vata are creating the problem, then you give a rasayana medicine after the shodhana. You have to give a sthanagata shodhana, at least a sadhya virechana. Sadhya virechana is not very useful, but yes, instead of doing nothing, you can do something with sadhya virechana, and then you start rasayanas like that according to the nidana. Then it is very useful. Then comes if the sperm count is less, then you have to understand that there is a dhatu kshaya again. Okay, so when there is a dhatu kshaya, you start asking questions about the dhatu kshaya. Why are you not exercising properly? When you don't exercise properly, one dhatu does not become into another dhatu. Are you not eating properly? What kind of nourishment are you getting? So on and so forth. What all, how much vitamins and minerals the patient is taking? How much of junk food the patient is taking? More junk food, it is indirectly proportional to the count. More junk food, less sperm count. It's a direct. Okay. And when the count is less, and then when the rapid progress of motility, should be at least around 50% for you to naturally conceive. If it is not 50%, then conceiving naturally will be a problem. So 50 million to 60 million count, normal morphology around 50%, and a rapid progress of motility around 50% is a normal thing. If the motility is not more, then you have to understand that the gati of the sperm is not good. The sperm is not able to swim properly, which means the sperm is not able to move properly. This can be because of the viscosity. If there is a high viscosity, then even a good motile sperm cannot swim properly, and it can show as if it is a sluggishly motile or a non-motile sperm. So if there is a viscosity problem, high viscosity problem, you reduce the kapha in that place, and you make sure you give some rasayana like Pippali rasayana, you give a virechana, you give a vasti which is brahmana and at the same time pitta shamaka. Okay, and sorry, kapha shamaka, not pitta shamaka in this case. It should be a kapha shamaka. And after you do this, you look at the motility, and if the motility is returned to normal because you have corrected the viscosity, then that is fine. But even after correcting the viscosity, if the patient's motility is not improving, then you have to give medicines specifically for increasing the motility. And when the patient exercises regularly, when the patient exercises the apanasthana regularly, if the patient has piles problem, if the patient has recurrent urinary tract infection, if the patient has a low back pain, mind you, any other pelvic problem, it can be a small pelvic infection that he has from some old this thing. If he has a constipation, okay, if he has a hernia, in Ayurveda, all these things mean that in the apanasthana there is a dosha. And if until and unless that dosha is relieved, my dear friends, you cannot have a complete relief from this one. So you have to look at the root cause and you have to treat that. So the motility, for increasing the motility, the first line of treatment that I give is vyayama. I ask the patient to go for good exercises in and around the pelvis, for the stomach, for the abs, for the core, for the hip. We give a lot of exercises. Exercise becomes the primary line of treatment in motility. There are also other medicines. We even use Mahanarayana Taila. Mahanarayana Taila Vasti is used when it comes to motility. We'll talk about that later. Then that's what, if the sluggishly motile is more or the non-motile is more, then for increasing the motility, we'll be doing these treatments. Then comes the morphology. If the morphology is not good, then the quality of the the akriti of the shukra dhatu or the bija is not good, then you have to go with the rasayanas and gritams. Gritams or rasayanas are the best solution for this. Like how you regenerate your body with rasayana and grita, in the same way, when there is a morphology problem, when there is a teratozoospermia, then you give more gritams like Mahakalyanaka gritam, Brahmi gritam, Jivantyadi gritam. There is no rule that you have to give this only through the oral route. You can use it as Vasti or Utravasti. There are many cases which I've seen where they don't want to take these medicines orally. They want gritams in capsule. They want Thailam in capsule. It happens in some places. Yes, you can do this. You can have it. I mean, for all that is said and done, Gugulatikta gritam, which is used in Klybia and in Vandyatva, is very much available in capsules. Coming to the morphology, we have seen some specific medicines like Panchakavya gritam does wonders when it comes to morphology. Okay, so when the akriti is not good, try and treat the akriti with the rasayanas and gritas. It will do more nourishment to the dhatu and more nourishment to the bija, and then the morphology will be cured. Then there is a cell debris. Cell debris is there can be epithelial cells if there is continuous urinary tract infection. So there can be red blood cells if there is some internal bleeding slowly. There can be pus cells if again there is some infection in the seminal pathway, and so on and so forth. So these are all Anya Dhatu Samsrishta. If there are epithelial cells, look at the infection that is there in the seminal pathway and give the exact opposite medicine. Sometimes Shatavari Gritam is used, sometimes I use Dadi Madi Gritam, Jivantyadi Gritam, I use Balashvagandhadi Tailam, Varanadi Gritam. Then whenever there is a Sangha, whenever there is a urethral stricture, there is a lot of cell debris. And then whenever there is a continuous urinary tract infection, I use Panchakavya Gritam, Brahmi Gritam. And then when I want to increase the morphology and when I want to increase the motility, Mahaga Narayana Tailam, Gugulu Tikta Gritam. So medicine is chosen according to the Nidana. This is what I'm trying to say here. So the Anya Dhatu Samsrishta, again, with a good Tikshna Virechana, most of this is cured. And other than this, you can use the correct medicine according to the Nidana, you choose the medicine. Lastly, if there is agglutination or phenilatva, then that can be because of kapha. Deranged kapha will be there. Yes, Vamana is very useful in agglutination and this thing, but in many cases, when they come to you, they are a Vamana Anarha. Sorry. When they are a Vamana Anarha, then again Vastis and internal medicines are used to decrease the kapha. There is a very interesting case when we give Talisadi Churna, this agglutination became all right. We'll talk about that later anyway. So if you know the dosha sthana properly, again coming back to the Nidana, my dear friends. For example, if there is a Vataja problem in the Shukra, you have to see all the Vata sthanas, especially the Pakvashaya. Pakvashaya, Kati, Sakti, Srotra, Asti, Sparshanendriyam, Sthanam Vatasya Tatrapi, Pakvadanam Visheshataha. These are all the Vata sthanas. You have to see, especially in the Pakvashaya, if there is any problem. For example, let us come to a different this thing. Usually I talk about this when I come to Pitta, but then, for example, in Pitta, you see Nabi Ramashaya, Svedo, Lasika, Rudiram Rasa, Driksparsharam cha Pittasya, Nabiratra Visheshatha, right? So if there is a Pittaja problem, for example, if the patient is having erectile dysfunction, at the erectile dysfunction, you do a penile Doppler. And in the penile Doppler, you come to know that the patient is having atherosclerosis of the arteries of the penis. And then you get a suspicion and then you go and check whether there is atherosclerosis in the vessels of the heart, yes, there will be atherosclerosis in the vessels of the heart. Yes, we have found this also. Okay. So here we treat the rudiram and the lasika. Okay. And when we did this, when we gave pitta shamaka drugs, and when we treated the rudiram, the patient's atherosclerosis disappeared, my dear friends. Daily nitya abhyanga and mridu sweda with warm water bath, because you cannot do tikshna sweda when it comes to the kaksha functiona. In all these places you cannot do, especially in the genital organs, you cannot do more this thing, svedana. I learned this painfully. In your practice, not only you succeed, many a times you also lose, right? One of my cases where I lost was one of my seniors, one of my gurus. He gave me a case. He said this person has a back problem and uh, seminal deformity. His count is less. He is in oligospermia, and I want some help to treat him. A very senior person. I said, I want to treat the back pain first. Yes, it was a good decision to treat the back pain first, but the treatment I chose was dhara, Tailadhara. So when I was doing Tailadhara for this person, I told them to use good hot oil for doing the Tailadhara. And when they did the Tailadhara, they did a mistake. They did not put a cloth soaked in cold oil. A cloth which is soaked in the same cold oil should be put over the Vakshana, should be put over the penis and the scrotum also when they are doing this thing, dhara, so that these places are not exposed to high temperature. I did not tell them to do this. That was a mistake. And after doing this dhara for around 8 days, and Vasti was also given, we did some Mamsarasa Vasti and all that. After doing all these things, still when the patient took a semen analysis from an oligoasthenoteratozoospermia, where he had at least some sperms left, he became an azoospermic person. That was one of my first early career, you can call it a defeat, you can call it where I was not able to succeed. Goes without saying that the patient did not come back to us when he saw. I always scientifically quantify my results. I always ask the patient to take semen analysis then and there, and this was one of my rare failures. So my dear friends, I did not take into consideration that in this case like this. In the atherosclerosis case, I took into consideration that it is a vata pitta disorder, and I treated it accordingly. I treated the rudira, and this patient got relieved of this. When it came to the last oligoasthenoteratozoospermia patient, he had a road traffic accident. Someone asked me what was the cause. He had a road traffic accident and he had a spinal injury, and because of this he had a severe back pain. So I had to treat the whole apanasthana. So I had to treat that place. So taking into consideration the nidana is very important, my dear friends. And then when you're you can see patients who are having very high viscosity of their semen. Many people have the habit of drinking beers. Many people have a habit of taking a lot of cashew nuts and all that, very heavy foods, a lot of paneer foods. They want to increase the protein, they take a lot of paneer. The kapha increases. When the kapha increases, did you know that there is a direct correlation between super increase of kapha and then the viscosity when it is very high, and then slowly the dhatu changes which has to happen even in the shukra dhatu becomes very sluggish, and because of that slowly the patient loses his libido, and at last you will see there is a gynecomastia. When there is a gynecomastia, Then when you are relating this to the kapha, then you will say uraha kanta shiraha kloma parvani amashayorasaha medro granam cha jihva cha kafasya sutaram uraha. In the uras, when the kapha is increased, when kapha is increasing, it can lead to this gynecomastia. One of the things that can be treated only with the surgery in allopathy. Yes, in Ayurveda we treat gynecomastia very successfully with only medicines and panchakarma. Like this, if you ask me to talk, my dear friends, I'll be talking about for each vata, for the high prolactin, the prolactin that for each vayu, for each the back pain problem, the back injury person. First, we were talking about the varicocele and hydrocele patient who fell down and he had a back pain, and because of that, he also had a testicular pain, and we treated him. He was using the Daturadi Vati, that is Vyanavayu and Apanavayu. Though the problem started from Vyanavayu and came to Apanavayu. Like this, nowadays we are having COVID patients who had, the patients who had the history of COVID, and because after COVID, when they come back to our fertility treatments, their this thing is very, very low. Their semen analysis has become very, very low than before. Purasthanam udanasya nasanabigalam sharit vak pravrti prayatna urja balavarna kriya. The bala is reduced very much, and slowly the sugar dhatu is also reduced. So from the Udanavayu to Vyanavayu. Why am I stressing on these things? If it is a Pranavayu problem, I will have more inclination to give a Nasya. If there is a Udanavayu problem, I will have more inclination to give Vamana along with some steam inhalation of medicines. I will use the medicine in an alcoholic form. For example, I will take Ashwagandha Arka, and I will ask the patient to take a good a vapor. It is also Rasayana. Along with that, I might use some Madaduda Vasika or something so that his lungs are also pure. So we see many people say after COVID they have got diabetes, after COVID they have got some COPD, after COVID they have severe hair fall, severe tiredness, some people have organ failures, and in our clinic we are seeing a lot of fertility cases, male infertility cases especially. So treating the root cause and treating the Udana Vayu is very important in these cases. Here steam inhalation proves extremely well once the patients that Udana Vayu is treated well, and then you also give some Rasayana along with that. Patient is very happy, and he also gets relieved of the complaint. Slowly his sperm count starts increasing to the old level, not the normal level, at least to the old level. Like this, you need to know from where this problem started, right? That is very important. And continuously eating outside, continuously eating a lot of junk food. We talked about this already. That can be Samanavayu. When the Agni is not good, when the patient is having a lot of constipation, that is also Samanavayu. Samano Agni Samipastaha, Koshte Charati Sarvataha, Annam Grinnati, Pachati, Vivechayati, and Munchayati. The Anna is also sent to all the parts of the body, and then Vivechana means dividing between the good and bad of the food, and then whatever is left out, the fecal matter, is then sent to the Apanasthana. So from the Samanasthana to the Apanasthana, if you know this, again you will give medicines for the Samanasthana. Sometimes an Indugandam Gridam can be the correct medicine for bringing back the semen count again, and also stopping the Nidana what he's taking. This you will understand when you, like this, you can talk about Panchavida Pitta, Panchavida Kapha. You can talk for each Panchavida Vata Pitta Kapha. Yes, you can talk that it can lead to Apanasthana. The Udbhavasthana and the Vektasthana, the Udbhavasthana and the Sthana Samshraya can be connected and correlated only with experience, of course. Somebody just now asked whether the COVID vaccine has any effect on the fertility Uh, yes, like how doctor has mentioned, I think Dr. Vasuprada has mentioned, yes, it induces oligomenorrhea and dysmenorrhea, menorrhagia and all in some cases. I have seen after COVID vaccine, people see these can be some sporadic cases, but yes, I have definitely seen people who have gotten skin trouble, severe skin trouble. When I say eczema, you cannot imagine the uh, severity of the eczema. Immediately on the day of having vaccine, or the very next day, I've seen eczema cases. Skin was cracked and it is just oozing and peeling. Where vata is affected, definitely the vata is affected, right? Because sparshanendriyam is affected. The same way, I've seen many cases where the semen count has gone down. I've not seen the morphology and motility going down. Till now, I've not had so many cases after COVID. We are still getting patients. It's not like before. But then, yes, it affects the count in many people. But we are not able to exactly confirm. The data is not very confirmatory, like you take a semen analysis before the COVID vaccine, then take the COVID vaccine, and after 1 week you take one semen analysis, after 15 days you take one semen analysis, after 30 days, 60 days, 90 days. So if you do something like that, yes, you'll be able to prove something with a lot of evidence. And no, if I say exactly, do you know according to data? No. But are we able to put 1 and 2 together? Yes. After giving COVID vaccine, we have a report where the patient has had treatment from us before, and then he has had a COVID vaccine, and then he has come back and taken another report, and then his semen count has gone down. But motility and morphology, no, I have not seen much. And then one of the next most important nidanas is the improper examination by the doctor. If you don't examine the person properly, if you don't do the proper genital examination, and if you don't, for example, when a person comes to you, you have to see, somebody is asking whether there is a solution for premature ejaculation. Medicines we'll be talking about in our second talk, my dear friends, on 25th. I'm not concentrating that here. I already have another 17 slides. I don't know whether I'm going to finish it here. Okay, but yes, we have excellent medicines for premature ejaculation, all type of ejaculatory disorders, anejaculation, anorgasmia. In all these conditions, we have excellent medicines. Okay, coming back to this, improper examination by the doctor. If you don't examine, when the person comes to you, you have to ask them to physically get examined properly and also do the tests which are exactly needed. And if you don't do that, most of the times you will miss out on what you are planning to see or what you want to see. Okay, and you also have to ask questions for all the Panchavidha Vata Pitta Kapha, all the 15 types of the subsets of the doshas, and you have to see where there is a problem. The patient might think you are a fool. The patient can think you are, ye pagal ho gaya hai. Okay, but that is not concerning you. Okay, you can ask whether you have a knee problem, whether you have a back problem, whether you have a headache. Okay, you can argue whether you have a skin trouble and all that, but the patient is ultimately going to answer to you. Even if you ask 100 questions, he wants a child, obviously he's going to answer you. Okay, he can think what not about you, it doesn't matter. Okay, so and then although without knowing, some patients, another nidana is some patients without knowing will be taking avrishya medicines. For example, they'll be taking yelakai, elateria cardamom continuously. They'll be taking a lot of lemongrass. They're thinking lemongrass is very good, very healthy. Sometimes it will affect the semen count. Taking ajwain, or in Tamil we call as omam. Okay, Trachyspermum honey, and then even moringa. Many people think moringa is very good, but only parts of moringa is good for your semen. Some parts are not. Okay, so the moringa seeds especially are not good for your moringa bija is not good for your bija. Moringa majja is good for your bija. And then all kind of Vata Prakopagara, Pitta Prakopagara, and Kapanabandha. This all I think we have seen already. I don't think we have to talk about all these things. Okay. Bija, Kala, Ambu, Krimi, Kita, Agni Dushitam. Okay, Acharya says all these things can be a problem. Bija dosha, we all know that Bija dosha, some genetic problem can create this plebia. Kala, according to Desha Ritu and Kala, this Kala has many different this thing. It can be the age of the person, it can be the time of conception in a lady, it can be fertile period in the lady, it can be the time of intercourse. Time of intercourse is very important. And then that is if they don't know the fertile period and they don't try at that time, if they are not trying in the early morning is a very good time, but you cannot force that on the people. Okay, you need to know, but they need to know that it is good to try early in the morning. Okay, many other, if you are Kala also means Aushadha Kala, it can be the Vyadhi Kala, it can be the Jirna Kala, it can be the Ritu Kala. Okay, all these things will contribute to the problem. And then Ambu here, it means the semen itself. It can be high in viscosity, low in viscosity, as we saw. There can be Krimi. Like how you take urine routine and culture, you can take a semen culture. And that we have seen all kinds of organisms. We have seen Enterococcus organism. The Escherichia coli. We have seen many other bacterial infestations. Many problems can be there. Okay. Those things can be treated by giving Utravasti, by giving Sthanika Shodhanas and internal medicines and so on and so forth. Okay, this is Krimi. Then Kita, Krimi Kita is again almost the same thing. Agni Dushitam, continuously getting exposed to over temperature can lead to varicocele. Many of my marine engineer patients who work in the engine room, it is a staggering fact that a person who very recently came from a marine engineering background, he's a sailor, he works in the engine room at temperatures not less than 50 degrees Celsius, 48 to 50 degrees Celsius. And he says, none of his colleagues who are working in that room, none of his colleagues, 100%, none of his colleagues who are working in that room have children. If at all they have children, they have it only through assisted pregnancies like IUI or IV. Most of them have tried IUI and IVF also, and it doesn't work for them. So this is Agni Dushitam. Again, in all these conditions, there can be problems, and according to that Nidana, you will be able to treat the doshaha, pratak samastaha, va prapya, retovaha siraha. Okay, like single dosha, two or three doshas can go into this thing. When you see, for example, in the Ambu, we talked about the seminal fluid's color, right? It can be yellow in color, or the liquefaction time can be high or low, the viscosity can be high or low, and so on and so forth. Okay, so in all these conditions, we'll see when we are seeing the medicines at that time, we'll see how this Nidana is connected to the medicine and so on and so forth. So other male factor infertility causes can be genetic content. Okay, you can go do a defragmentation of the sperm, and you can know that there is degeneration and all that. Basically, Charakacharya says Shukra Dhatu is the Sarva Dhatu Sara. It is the blueprint of the whole body. It is a Sarva Dhatu Sara, blueprint of all the cells in the body. Like a diploid germ cell in the body is how it is the blueprint of all the cells, like that. And then semen has other different fluids also. You have to look at the whole seminal pathway from the seminiferous tubules, the testicles, whether there is any varicocele, whether there is any hydrocele, whether there is any hematocele, whether there is an epididymis swelling, is there a cyst in the epididymis, whether the seminal pathway is obstructed by any neoplasmic this thing, whether there is a prostatomegaly, whether there's a continuous urinary tract infection, whether the bulbourethral glands are infected, whether there is an urethral stricture, and so on and so forth. There are many other conditions also we have talked about, whether there is a retrograde ejaculation, and so on and so forth. So you need to know the seminal pathway correctly. If you don't know the seminal pathway correctly, you will not know what are all the things that can affect the person. You will not know what to test him for. If you do not know the nidana, you don't know the investigation. If you don't know the investigation, you will not find the problem. If you don't know the problem, then you will not give the correct medicine. Okay. Other infertility causes can also be like sexual dysfunctions, like erectile dysfunctions, or one person asked about premature ejaculation. Yes, in all these conditions, treatments can be given. And then diet. The malnourishment can lead to Shukradhatu Kshaya. Overnourishment can also lead to, we were talking about that before, overnourishment can lead to too much of kapha in the Shukradhatu, and there will be a stagnancy in the way the dhatu is progressing, and there will be immature cells in the this thing, seminiferous tubules, and it will not get conformed into good this thing. Even we have talked about varicocele and so other things where that can also lead to male factor infertility. And there are also other combined factors. Not many people know what is Gramya Dharma. You need to read the chapter of Gramya Dharma. Gramya Dharma is a separate class. You need to understand this completely and then advise your patients. I will try to tell you what all counseling I'll give to my patients. Number one, do a basal body temperature every day morning for the lady. Number two, when the basal body temperature is done, you have to do it from the first day of the period so that you get a good hang of it. And then there will be one day, if it is, for example, 97 degree Fahrenheit, next day it will be 97.2, 97, 97.2, 97, 97.2. Like that, there will be a lower level and higher level which is established. So it will keep going like this. The chart will keep going like this. One day near the this thing, ovulation, that there is a higher level and lower level which is established, right? 97 and 97.2. This is only an example, okay? And then one day lower than lower, the graph will go below 97 degree Fahrenheit that day, and next day or after 1 or 2 days it will become higher than higher, more than 97.2. Both of these days can be her ovulation days. Excuse me. This they cannot miss. And then they need to, or they can also use a ovulation kit to know when the ovulation is happening. They can use a follicular study to know when the ovulation is happening, when there is a rupture, and they can use that day to have intercourse. It has to be done. Other than this, I also ask them to try early in the morning between 3 a.m. to 6 a.m. And then I give them different postures. I tell them what kind of postures they have to take, how gravity can be used so that the sperm is deposited high in the vagina. Depositing high in the vagina is very important. And then the withdrawal of the penis is very important. You cannot just immediately after intercourse is over, you cannot just withdraw your penis if you want a child and if you're already an infertility couple, a couple suffering from infertility. You need to allow the penis to automatically lose its flaccidity, and then the ejaculation has to happen completely inside, and then depositing high in the vagina. There are some specific techniques, keeping some 3-inch height pillows below the pelvis of the lady, making her turn to one side. There are many things that you can do. All these things are also taught to them. Then we teach them what is fertile period, and in fertile period you cannot try daily. You have to tell them, ask them to try once in 2 days, and all these things are told to them. And having a very clean, clear, very enthusiastic mind is very important. Even though they have been trying for years together, it is important for them to try with enthusiasm, because in Clibia, the first word Acharya uses to describe Clibia is Sankalpaha Prabano Nityam Priyam Vashyam Apistriyam. Sankalpaha, already this person has, the male has the Sankalpa to go for the sexual intercourse. And the lady is also Priyam Vashyam Apistriyam. The lady also has given her consent. And still, if he is not able to get a good erection, only then he can be called as a erectile dysfunction, a person who is having erectile dysfunction. Then Shukra Dhatu, Sushruta Acharya calls it Shukra Dhatu as Bijartha. He doesn't call Shukra Dhatu itself as sperm. And then that is for protecting the bija, Shukra Dhatu is available, which means he is talking about the semen. He's not talking about the sperm. The semen carries the sperms, which are the bija. So he knows what is bija, and he also knows what is Shukra Dhatu, that is the semen. Or else he is not going to use the word Shukra Dhatu is Bija Artha, for Bija. Okay. And then this is the next sloka. I think we all know Purishasya Yada Bija Bija Bhagaha Pradosham Apadyate Tada Vandyam Janeti. Okay, Chargashadisthana. When a part of the bija, when it is affected, bija bhaga is affected, when the part of the gene foci is affected in the genes, then yes, there can be some problem. Okay, we all know this. Then there is no better evidence than this telling that our acharyas knew about the spermatozoa, they knew about semen, or else he is not going to use the word bijartha, and then the genetic material, genetic defense, and the fragmentation of the sperm, and so on and so forth. So whenever there is a person who is coming with a congenital vandyatvam, Klinefelter syndrome, Kalman syndrome, and so on, I don't take the case. I have not treated anybody like that. And then this Sankalpa Pravana Nityam Privam Vashamapi Striyam, we have already seen. He is not able to go for a sexual intercourse even when both of them have the consent because of Linga Shaitilyam, because the Linga is very flaccid. Even after that, Kadachit Yativa Yadi, even if he is able to, because of the over enthusiasm, if he is able to undergo, he is able to go ahead with the sexual intercourse, Shwasartaha, Swinnagatraha, he gets full of dyspnea and the whole body becomes very much perspired. Moha, he becomes very, like he starts getting chakar and Mlana Shishnascha. In between, when he is having the intercourse, he gets Mlana Shishna. That is, he will lose his erection. So, guys, this is mostly about Nidana. Yeah, I think in the second class, if there is anything else to talk about Nidana, I will continue because we only have another 10 to 12 minutes. So I would like to take some questions if you are all ready.
Thank you, sir. Already, I think the questions has been cleared somewhat. One question is pending, sir. Can I ask, sir?
Please, please.
Atherosclerosis or Peyronie's disease, please explain.
See, when you get atherosclerosis, I think you are talking about the case that I was referring to, right?
Yes.
I think so. In this case, whom I got, I will start talking about from my case. This person who came to me, he was in his late 40s. He was not getting proper ejaculation and he was not getting proper erection also. Okay. When we talk about atherosclerosis, yes, there will be some, like in a heart disease, when you have atherosclerosis, to be very laymanly about it, there will be a drying up there will be a vata increase in these rakta bahasrotas, to put it very, very crudely. Okay? That is, we say there is buildup of fats, there is a buildup of cholesterol and other substances. Okay, and because of this, the artery walls gets destroyed, and this person will have a plaque in the walls and all that. This is a atherosclerotic case. But in my experience, I have not seen any fibrous scar tissue inside the penis and all that. This is my experience I'm talking about. That is Peyronie's disease. Peyronie's disease, what he's talking about, what the doctor is asking about. I have not seen that. It is called as penile fibrosis, what you're asking about, Peyronie's disease. But in atherosclerosis, there is a plaque formation inside the small arteries and the arterioles in the penis. Okay. In this condition, as I told you, we can give a lot of Mridusvedana and Abhyanga. This case, we gave Balashwagandha Taila Abhyanga. The patient did it by himself with warm oil and then Mridusvedana by taking bath. Other than this, we also gave some Uttaravastis and this thing Kashayavastis. If I'm not wrong, I used Yashti and Mustadi Yapanavasti. In the Mustadi Yapanavasti, I used it along with Yashti, because the Yashti I usually give whenever there is a plaque built up in a person who's having atherosclerosis, and the same technique I used in this person, and excellent result was there. After about 2 courses of Panchakarma and internal medicines, once we started with the general Ayurvedic principle of starting with the Tiktaka Kashayam, then we went to a Tiktaka Brahmana Kashayam, then we went to other Gritams, and after we gave the Gritam, at last we gave Rasayanas. When we gave the Rasayanas, in this condition, I used, if I'm not wrong, I can take the case sheet again and I can maybe let you know. First, we used Pipali Rasayana, and then we came to Narasimha Rasayana. And Brahmi Vati was one of the most important medicines that we used. Brahmi Vati gave excellent results in this case. We had to give some kind of Brahmana, and yes, the plaque buildup has reduced and the patient's erection has become all right after this. Any other question?
Okay. The next question: patient complaint of infertility, associated complaint or associated complaint orchitis, DVP in inguinal region, and female partner have PCOD. Which one we treat first, sir?
Okay. So usually when there is a problem with both of the male and female, when you have in both of them, okay, then you try to treat both of them simultaneously. Okay, case of infertility associated with complaints of orchitis. If there is a orchitis, then you are supposed to do the USG, and then you have to know that there is an orchitis, whether the orchitis is associated with hydrocele, whether it is an injury induced orchitis. If it is an injury induced orchitis, whether there is any hematocele, that you have to see first. And then the female partners PCOD is very easy to treat with Ayurveda. PCOD is you can treat PCOD right and left with Ayurveda, no laparoscopy, nothing needed. Even when it is associated with any other adenomyosis, endometriosis, pain during the menstruation, and all these things, very easy to treat with Ayurveda. I think other stalwarts are there who are going to talk about the ladies' PCOD, but yes, you have to treat both of them simultaneously. And in most of the orchitis cases, we give Pichu, okay, and in one case we gave I use a lot of Balashwagandhadi Tailam, because that was one of my drugs that I used in my PhD. So I'm very fond of Balashwagandhadi Tailam. So I use a Balashwagandhadi Tailam Pichu, along with, once we tried Moshika Tailam for this orchitis. It worked very well, but I tried in only one case. Maybe I can try in other cases and I can let you know. Pichu is given, and then some internal medicines are also given. Orchitis, so first treat the orchitis, and the inguinal region, any problem for that matter of fact. Okay, if there is any problem in the inguinal region, there can be an inguinal hernia, there can be any other thing which is in the Apanasthana. But first, it is always important to treat the orchitis, because with orchitis, most of the times you cannot have any this thing. Most of the times the patient does not conceive, and the whole process of intercourse itself becomes very painful when there is orchitis. Okay, neither the patient can masturbate and give a sample for semen analysis, nor can he have any this thing intercourse properly. There will be a lot of pain, so the patient will also can experience dyspareunia because of the orchitis. Okay, so yes, treat the orchitis first, and then go for any other inguinal region problem. And female partner has to be treated simultaneously. There is no point in delaying that also. Next question, please.
Next question. So what is the dose of the Turadivati?
Datturadivati, in this case, one case we were talking about uh, varicocele, right? We were talking about the varicocele
Yes.
patient where Datturadivati was used wrongly. Okay. Usually, Datturadivati, it is given to induce clybia in many people. Okay, I think you would have known that in our acharyas have told that if you get good potent Datturadi, this thing, Datura, you can use that as a, by tying around the waist, it can be used as a uh, uh, means for not conceiving, okay, like a contraceptive. Okay, but this Datturadivati, 1 or 2 tablets is taken and then it is pounded with a little bit of water. In some cases, some other liquid that we give, some cases arca, and this can be taken and applied on the pen, this thing on the scrotum. 1 or 2 tablets is more than enough. If the hydrocele or the varicocele, if the size of the scrotum becomes very big because of this, then yes, more tablets will be given. That will be decided on the spot only. Usually, I don't use the Turadivati too much. Very sad.
Next question. If vitamins intake is necessary with Ayurvedic Panchakarma and medicinal treatment.
When this doctor is asking about this, I am assuming whether he's asking whether he or she is asking whether synthetic vitamin have to be given. That is from the allopathic. This is what I'm trying to understand. Okay. If you're asking about natural vitamins, if you're asking about the phytochemicals where vitamins can be given through phytochemicals through foods and vegetables, yes, definitely you have to give that. There is no point in not giving that. But vitamin supplements, I never give. Most of the times when the food given, and if you are taking care of the Agni properly, and if a proper Virechana is given, before that some Agni Deepana is done properly, and then the Vasti is given, and then the vitamins take care of themselves very easily. And the vitamin D3 is one of the things that there is a problem. You are not able to synthesize vitamin D3 properly, then there are ways to improve your vitamin D3, but that is a part of the second class.
Okay. With that, I think we can wind up the today's session, sir. Other doubts can be cleared in the WhatsApp group.
Sure.
Our next class, sir. And from bottom of the heart, from on behalf of Team Pratignja and myself, thank you so much, sir, for such a wonderful and clinical oriented classes. And we will be seeing you in the upcoming session also, sir.
Thank you, doctor.
Thank
I again thank Pratignja team for giving me this opportunity, and my good friend Dr. Sham, Dr. Anjana, and Dr. Rahul, and yourself too, doctor. Thank you.
Thank you, sir. Thank you so much.
Looking forward to more. Yeah.
And dear participants, today is exclusively free, and for those who are not yet registered, grab your seats as soon as possible because it is completely clinical oriented classes regarding with the Pratignja. It is a 15 days online certificate course on art of infertility management in Ayurveda, and it is led by 8 faculties with eminent knowledge and their clinical experiences. So don't waste your time and grab your seats as soon as possible. And before winding up, let's have a look through Pratignja's online certificate courses already, which we have completed successfully. And with very much pride, I just go through it. This was our first class regarding cosmetology, trichology, and diet modification. And another class was regarding that Kerala Panchakarma, and another course was regarding with Agnikarma in clinical practice, and another one is clinical utility of Uttarabasti, and one certificate course on related with aromatherapy, SOPs and product making in cosmetology and trichology in Ayurveda, and we have completed a successfully Asian entirely different course explaining about the clinical methods and prescriptions in Ayurveda. and we have completed a course related to Asti Karma, and we have also completed a online course related to Subhalyam, which is a detailed description of pediatrics in Ayurveda. And nearby we have completed Ritu Samiksha and Sparsha, Art of Managing Dermatological Disorders, also been successfully completed by our team. And another one was Rudiram, a course related to Rektamokshana. And this was our second batch of Kerala Panchakarma. And this also was the second batch of Ayurvedic cosmetology, trichology, and product making. And we have gone through Brihat Saptaha, an online certificate course with 21 days. And we have completed a second course of Agni Karma in clinical practice also. And now we are on the stage of PRAJANANEEYAM, which has been led by 8 eminent faculties. And you can ask any doubts regarding the clinical approach of infertility in our registered WhatsApp group. And if you are not being registered, as soon as possible, you register the course, and you can you will be available all the recordings till 6 months, and you can clear all your clinical approachable doubts regarding the course and be the doctor with so much of knowledge with the help of our leading gurus. And this was some of the other courses also. Aromatherapy, rheumatology and its management in Ayurveda. We have completed another Meha and Sirajam, Prakrishtam, and Kerala Panchakarma and Ayurvedic cosmetology also. And these are the valuable reviews also we have got. And next class, it will be tomorrow regarding Ayurvedic and modern understanding of Nidanas leading to female infertility. It is led by Dr. Sitara. And for any concerns and suggestions, please visit at pratignja@gmail.com, and you can save Dr. Shyam Mohan, Dr. Anjana Unikrishna, and Dr. Jayashankar's numbers. And today we are winding up the session. And knowledge with a record, knowledge is knowing what to say, and wisdom is knowing when to say it. So with this, we are winding up with the team, Dr. Anjana Unikrishnan, Dr. Rahul Jayashankar, and Dr. Shyam Mohan. And keep growing and keep learning with Pratignja. And thank you all. Thank you once again.